Welcome to Session 4 of Foundations in Global Health. In Session 4, we're going to talk about the role of governance. And we're going to talk specifically about the role of UN agencies. So, this session will talk specifically about the UN and all of its agencies and its functions. In our previous sessions, we've talked about how the WHO Constitution defines health and what is health. In this specific session, we're going to talk about the UN's role in health and promoting health. Ultimately, we have to understand that local government and even national governments have the ultimate responsibility and accountability for population health. We also have to understand that globally, regionally, and national policy and funding affects local decisions. For example, the Sustainable Development Goals, the WHO, and other organizations and constitutions also define health. And in fact, governments alone are insufficient and need to work with the other ever increasing number of actors to promote health and actually execute on the promise of delivering health to their organizations and to their populations. The main reason that individual governments cannot deliver on health alone is that we live in a globalized society. Globalization has intensified cross border health threats. For example, COVID 19 and the pandemic that has emerged from COVID 19 is a prime example of these cross border threats and it has led to a situation that health and actually the health of citizens has become interdependent. So the notion that no nation or organization is able to address single handedly the health threat it faces is true, but instead must rely on to some degree on others to mount effective responses is truly true. We live in a globalized society. So the organized social response to health conditions at the global level is what we call the global health system. And it's the way in which the system is managed is what we refer to as governance. So basically here on this slide is the governance can be defined as the alignment of multiple actors and interests to promote the collective action toward an agreed upon goal. And when we think about governance, there are some indicators that we can use in terms of defining good governance from bad governance. And in fact, the World Bank has defined these indicators. There are 6 indicators here that are listed in terms of good governance that can define good governance. The World Bank has listed these indicators from voice and accountability, political stability and lack of violence, government effectiveness, regulatory quality, rule of law, and control of corruption. I want you to notice they didn't say lack of corruption, but control of corruption, because even the World Bank understands that in any government, you cannot have zero corruption, but you have to be able to control corruption. This is a screenshot from the World Bank World Governance Indicators, and the URL below can take you to that website. And this is a screenshot that I took that shows the World Governance Indicators for the regions. And I just took 2 specific indicators: political stability and absence of violence or terrorism here for these world regions, and also control of corruption. And as you can see here, based on these world regions, North America was ranked as highest in terms of governance indicators for the 3 time points that I selected: 2009, 2014, 2018. And then for control of corruption, again, North America was ranked highest. It wasn't at 100. So that shows you that in at least by World Bank standards, North America has governance Um, However, I think based on what we saw in January 6th, I think that the World Bank might need to adjust their definitions of at least political stability um, in the coming years as they update their data. That organization of populations into nation states is called the global health system as we know it. And the UN system that we have in terms of multilateral institutions is part of that nation state system. So, in terms of that global health system, it functions to mainly um, produce four things, which is indicated here in Table 2. But there are significant challenges that exist within that plural system and not having a national sort of world government. Now, the functions of that system are basically produces many public goods, mobilization of global solidarity, stewardship, externalities across countries and management, etc. Um, However, because it's a pluralistic system, and there is no sort of central authority. Um, in many ways, many countries that have an outside speaking voice can shape the agenda to their liking, and many smaller countries who do not have an outsized or specific ability to speak up or can be marginalized within that sort of pluralistic system that exists. Now, there are challenges. Three challenges are indicated here. There's the sovereignty challenge. The absence of a world government. There is an inherent tension between the reality of national sovereignty and the imperative of the international collective action to properly manage interdependence. There's the sectorial challenge, in which the global health is increasingly the product of a cross-sector interdependence, that is, the outcome of policy processes across multiple sectors. So sometimes when you enter into treaties, the main objective of the treaty can sometimes end up not necessarily achieving all the goals that it has set out to be. And then there's the accountability challenge. Who is truly accountable at the end of the day? Another challenge is that this is an area of a multitude of public and private actors with compelling and many competing interests. This is just a screenshot of just a small sample of the different multiple entities that exist within the global health sphere. And all of these different actors have multiple competing interests within the global health sphere. And many times their competing interests can conflict with each other, and sometimes they can, even individuals and organizations within the same sphere can have competing interests that can conflict with each other. So, this is also a significant challenge. So, to reiterate, within the global health system, you have multiple entities here. There is no world government. You have multiple sectors, including philanthropies, the WHO, countries, the UN and the UN system, including civil societies, hybrid partnerships, private sector, media, bilateral corporate agencies, academic institution, including, for example, NYU, where you're at, multilateral organizations, all within this particular system. And this system has to coordinate trade and investment, education, migration, environment, agriculture, security, and so many other policies, and manage those particular policies and competing interests. So this is a significant challenge. And sometimes some of these things are successful, sometimes some of these things are not successful, but in many ways it is always a challenge to manage so many voices and competing interests within this global health system. So the UN was basically created after World War II. What is the purpose of the UN? The UN has basically three pillars: human rights, peace and security, and development, as indicated by here. The main four purposes are to keep peace throughout the world. It was created after World War II. Main purpose: to develop friendly relationships among nations. Now, there has been wars developed that have occurred after the development and creation of the UN, but there has not been a world war since the creation of the UN. So, by that measure, you can say that the UN as a multilateral organization has been successful. Third, to improve the lives of poor people, to eradicate hunger, disease, illiteracy, and to encourage respect for each other's rights and freedoms. It has made progress toward that in its goals, and to be the center for helping nations achieve their goals. And you can say it has been moving forward in terms of achieving that. So basically, these are the main purposes of the UN. The UN is organized into six principal organs. There is the General Assembly, which is usually consists of all the member states, which you normally see. They meet in New York here. There's the Security Council, which you normally see on TV discussing usually security threats in terms of different countries. There's the Economic and Social Council. There's the Secretariat. There's the International Court of Justice. And there's the Trustee Council. This material is included in your reading material for the class. So I encourage you to look over this and become familiar with the different organs of the UN. The UN can be divided into two main things, two main organs. The UN funds and programs and specialized agencies. The funds and programs are established by resolution of the UN General Assembly and have a focused mandate. They are funded through voluntary contributions. And then you have specialized agencies, which are autonomous organizations brought into relationship with the UN through negotiated agreements. They have separated budgets, members, rules, and personnel. Their funding comes from voluntary and assessed contributions. Now, coordination of funding, programs, and specialized agencies is facilitated through the United Nations Economic and Social Council and the UN Systems Chief Executive Board for Coordination, or CEB. There are 15 UN specialized agencies, and they are listed here. I'm not going to go through all of them, but a few that you might know is the Food and Agricultural Organization, which includes the World Food Program, the IMF, or International Monetary Fund, which you usually have heard on TV, the United Nations Education, Scientific, and Cultural Organization, which usually has the UNESCO heritage sites. They usually designate special World Heritage Sites. Of course, the WHO, the World Health Organization, which we discussed at length, and of course the World Bank, which we'll discuss further. We can also look at the expenditure of the 20 largest UN agencies, and this is based on 2016 budget numbers. These budget numbers have not changed significantly in 2021. So the largest by budget is the UN Peacekeeping Operations, which is $8.9 billion. Next, followed by the UN budget, 5.7. Some of the things that you will also see here is the UN Children's Fund, or UNICEF, which many of you might be familiar with, which is $5.4 billion. There's also the High Commission for Refugees, which is $3.8 billion. Here's the World Food Program, which also does things like provide food assistance for countries when there's experienced drought or any sort of natural disasters, including flooding, $5.4 billion. There's the UN Development Program, 4.7. And of course, what we've talked about here is the WHO, or World Health Organization, $2.5 billion. What does the WHO do? Just to reiterate from previous sessions, was created in 1948 as part of the United Nations. It has a broad mandate to guide and coordinate the international policy for health. It develops partnerships with other global health initiatives, conducting research, supporting norms, providing technical support, and monitoring health trends. It also maintains a list of essential medicines and diagnostic tests and provides guidance for priority medical devices. And in fact, these essential medicines lists are very helpful for low and middle income countries because based on those essential medicines lists, they can apply for loans from the International Monetary Fund or the IMF in terms of trying to increase capacity within their health systems. It has the exclusive authority to declare global health emergencies, including the pandemic, and in 2019 it identified the 3 priorities in line with the Sustainable Development Goals, providing health coverage for 1 billion more people, protecting 1 billion more people from health emergencies, and ensuring another 1 billion people to enjoy better health and well-being. This is the overall structure of the World Health Organization. You have basically a Director General, an Executive Board, and the World Health Assembly. In addition to that, the Director General has headquarters, program, and staff. You have regional directors, and which also have regional committees. In addition to the regional directors, you have 6 regional offices. These regional offices include one for Africa, the Americas, East Asia, Europe, Eastern Mediterranean, and the Western Pacific. And all of these regional offices have, of course, member states and offices. The WHO budget has basically remained steady in terms of its assessed contributions. What has fluctuated has been its donations. As you can see here, its donations has increased to about $4 billion or so total. And the donations include a whole host of individuals from the United States, Bill and Melinda Gates Foundation, Gavi, different nations, including, for example, United Kingdom, Germany, Japan, European Commission. Other entities include the World Banks and 35 different other entities, including other nations and Rotary International. The World Health Organization works with entities in different countries. These entities are equivalent to the Centers for Disease Control and Prevention within the United States. These entities are actually called Ministries of Health in other countries. The Ministries of Health in other countries have the governmental role. They have a reporting role to the president or prime minister in their country. They either report to the parliament or Congress also in their countries and also work with other ministries, for example, the Ministry of Finance, Environment, Agriculture, local governments, etc. In addition, they also work with other, in their countries, universities, advocacy groups, business organizations, think tanks, professional organizations, research institutions, etc., and also semi-autonomous organizations. So within the context of the uh, Ministry of Health organizations, they work with regional partners, and then they work with global organizations, including, for example, the WHO. So this is the context in which ministries of health work within the global context and also the regional and local context, similar to the way our CDC also works within the United States. They work with local partners, regional partners, including the states, for example, the local or state centers of health in terms of putting forth COVID regulations and also receive data from the state in terms of COVID regulations and the number of deaths from COVID and report out to um, the president and so forth. I'm going to briefly highlight four UN organizations that I thought are interesting, including the UN Children's Fund, the UN Development Program, the UN Population Fund, and the World Food Program. There are several other notable UN organizations and UN related organizations, which I would encourage you, if you have an interest in, looking up because they have a multitude of functions that really intersect with global health. I think most people are very familiar with UNICEF. I think many people have seen a TV commercial or two about UNICEF in terms of requesting donations. UNICEF stands for the United Nations Children's Fund, and is in actuality a successor to the United Nations International Children's Emergency Fund, which was also known as UNICEF and was created in December 11, 1946 in New York, and it was actually to provide immediate relief to children and mothers affected by World War II. Again, just basically in relation to the function of the UN, which was basically after World War II to make sure that um, what occurred in World War II did not occur again. In brief, UNICEF is governed by a 36 executive member board, and of course, it approves of its policies, programs, oversees administration, and financial plans. UNICEF works in over 190 countries and territories to save children's lives, defend their rights, and help them fulfill their potential. And it is responsible for 7 of the Sustainable Development Goals and indicators, and is a co-custodian of another further 10 of the Sustainable Development Goals. It works in structured around 5 overarching areas as well-being of every child to make sure every child survives and thrives, every child learns, every child is protected from violence and exploitation, every child lives in a safe and clean environment, and every child has a fair chance in life. The United Nations Development Program is the UN's global development network. It promotes technical and investment cooperation among nations and advocates for change and connects countries to knowledge, experience, and resource to help people build a better life for themselves. UNDP implements 6 cross-cutting approaches to development known as signature solutions to help achieve the Sustainable Development Goals. These 6 cross-cutting approaches include keeping people out of poverty, governance for peaceful, just, and inclusive societies, crisis prevention, solution for development, clean, affordable energy, women's empowerment, and gender equality. UNDP funds and manages the UN resident coordinators to lead all UN country teams and are the designated representatives of the Secretary General for Development Operations. The UN Population Fund supports reproductive rights for all and access to a wide range of sexual and reproductive health services, including voluntary family planning, maternal health care, and comprehensive sexual education. UNFPA supports reproductive health care for women and youth, the health of pregnant women, reliable access to modern contraceptives, trained skilled birth attendants, prevention of gender based violence, abandonment of female genital mutilation, prevention of teen pregnancies, end child marriages, and delivery of safe birth supplies. The World Food Program is the food assistance branch of the United Nations. It's the world's largest humanitarian organization, the largest one focused on hunger and food security, and the largest provider of school meals. It was founded in 1961 and is currently headquartered in Rome, and it has offices in 80 countries. WFP is the leading humanitarian organization saving lives and changing lives, delivering food assistance in emergencies and working with communities to improve nutrition and build resilience. WFP efforts focus on emergency assistance, relief and rehabilitation, development aid, and special operations. Two-thirds of its work is in conflict-affected countries where people are 3 times more likely to be undernourished than those living in countries without conflict. WFP is an executive member of the United Nations Development Group, a consortium of UN entities with the aim to fulfill the 17 Sustainable Development Goals with a priority for achieving SDG 2 for zero hunger by 2030. WFP was awarded the Nobel Prize in 2020, last year, for its efforts to provide food assistance in areas of conflict and to prevent the use of food as a weapon of war and conflict. There are several other UN organizations that I could talk about, but I'm going to end here with this other notable UN organization called UNAIDS. And if you haven't heard of it, I think that this organization has been significant in the fight against the HIV/AIDS epidemic. HIV/AIDS epidemic is has been a significant threat, and hopefully it will not be a public health threat. UNAIDS has provided leadership and advocacy. It has provided strategic information and analysis, also tracking, monitoring, and evaluation. It has provided civil support, civil society engagement, and partnership development, and also mobilization of resources. It is the only joint program within the United Nations systems that consists of 11 UN organizations. As I am showing here with the UNAIDS logo, you can see all the other UN agencies that are part of the UNAIDS program. So it has been a very powerful advocate supporting the UNAIDS epidemic and the efforts in terms of combating AIDS. So just to highlight some of these programs in terms of the reach of the UN has significantly had a reach in terms of both high income, low and middle income countries in terms of its activities, its day-to-day activities. Although we have not talked about it as part of this lecture, I implore you to go to this website URL to read this material that was provided by the UN, in which it talks about the UN at 70. This was provided over by Ban Ki-moon, in which the UN turned 70, and talks about the way that it had made a difference in various areas, including, for example, I just took a screenshot on the first three areas: peace and security, economic development, and social development. I think you'll be fascinated by how the UN has made a difference in the lives of various individuals around the world at 70.